Hi, so my name is Ansley Medina and I'm a student nurse from the University of Manitoba. So today I'm going to be doing a video demonstration on how to reconstitute, dilute, and give an IV medication through a mini bag. So the first thing I need to do is to hand hygiene, so that's the most important thing. And then I also need to check the doctor's order and then compare it to the MAR. So I have here my patient is Ms. De La Cruz. She has pneumonia, and then my doctor's order is cefoxitin 1,500 milligrams IV to start now and every 8 hours. So cefoxitin is an antibiotic, so it would be very useful for the patient's pneumonia. So I know that I have the right reason. And then after that one, I'm now ready to go to the Pixie's room to get my medication. Okay, so when I'm pulling out the medications, let's say for example, I already have the cefoxitin, I am doing my first set of checks. So just make sure cefoxitin for Mrs. De La Cruz, 1,500 mg, IV, the time is now, and every 8 hours. So since cefoxitin comes in a 1 gram vial, I need to get 2 vials for me to be able to get the 1,500 mg doctor's order or the dose. And then now, I'm ready to prepare. So first up is that cefoxitin comes in a powder form. So I need to check the drug monograph to see how it should be reconstituted. So it says here on the drug monograph that a 1 gram vial, you should add 10 ml of sterile water to get a final volume of 10.5 ml and a final concentration of 95 milligrams per ml. So I already have my 2 10 ml sterile water here. And then I'm just gonna do my second checks before preparing. So cefoxitin 1,500 milligrams for Mrs. De La Cruz, IV, every 8 hours, and then the time is now. Okay. And then I have this, and then now I'm ready to prepare. So first is I need a 10 ml syringe and a blunt needle. Make sure that the ends are sterile still. And just remove that one. And then now, next thing I need to do is to alcohol swab my 10 ml sterile water just to make sure that it's clean and yeah. So swab for 30 seconds and then let it dry for 15. And then since we need 10 ml of water, we could withdraw 10 ml of air from the syringe so that we could create some of the pressure inside. So we inject, and then we push the 10 ml of air, and then get the 10 ml of water, sterile water. Okay, make sure there's no bubbles so that we have the right amount. Okay, there you go. Make sure to cup it again so that it maintains the sterility. And now we're ready to mix it with the cefoxitin vial. So we just need to clean the ends again, or the opening, 30 seconds, and then let it dry for 15. Inject the 10 ml of air. And then since we created the pressure inside, just let the plunger of the syringe go back by its own so that we could relieve some of the pressure. Okay, there you go. Next thing we need to do, just roll between our hands gently, just to make sure that the powder medication is well mixed or well dissolved. Okay, there you go. Check. And then next thing to do is to do the other one. So same thing with the first one that we did. So just clean the opening for 30 seconds, let it dry for 15. Draw 10 ml of air. And then inject, insert, okay, there you go. So we have 10 ml. Then same thing, clean the opening of the cefoxitin for 30 seconds, let it dry for 15. Inject the sterile water, allow the plunger to go back on its own. Okay, there you go. Okay, gently roll between our hands just to make sure everything is mixed. Okay, there you go. And then now that we have everything in here, since we want to give it IV, we just need to make sure that we check the drug monograph again. So it says here on the drug monograph to dilute the medication in a 10 to 100 ml D5W normal saline lactated ringers or dextrosaline combination and administer over 20 to 60 minutes. So I choose to dilute the medication using a 100 ml normal saline and to run it over 60 minutes because though the patient has no known allergies, this is the first time that the patient, Mrs. De La Cruz, would be receiving cefoxitin. Therefore, I want the medication to be more diluted and to be given over a longer period of time just because or just in case there would be an abrupt allergic reaction or adverse reaction, I can catch it easily, and also the risk for the patient having a much more severe allergic reaction would be lessened. Plus, also, as we all know, normal saline has the closest composition of our body, and then also the patient is running the normal saline as the primary line. Okay, so next thing to do is to just make sure that the secondary bag is not expired. There's no crystallization. The consistency is clear. Okay, and then now we're ready. So first, to get the ml for the computation. So my doctor's order is 1,500 milligrams. So I just divided that to 1,000 mg, which is the stock dose, times the final volume of the one in the vial, which is 10.5 ml. So I will be getting 15.8 ml to get the 1,500 milligram dose. Okay. So to get the accurate measurements, I'll first get the 10 ml from this vial and then the other 5.8 from the other vial, just to make sure that I have the accurate measurement. So using a 10 ml syringe, I first pull 10 ml of air and then swab the opening for 30 seconds, let it dry for 15. Oops. So we just need to re-swab that again. So 30 seconds and then 15. Inject the air. Get the 10 ml. Okay, make sure there's no bubbles because we don't want to inject because we don't have the right measurement. Okay, there you go. And the next thing we need to do is to swab the end of the secondary bag. For 30 seconds, let it dry for 15 again. Inject the 10 ml of syringe. Inject the 10 ml of medication. Okay, so now we have 10 ml in there. We just need to get the remaining 5.8. So let's swab for 30 seconds. Let it dry for 15. We withdraw 5.8 in the syringe of air. Okay, there you go. Inject. And then get 5.8. Okay, make sure there's no bubbles. Okay. So we need to swab again the medication port. For 30 seconds, let it dry for 15. Then we can inject.
You guys have 30 minutes.
Okay, so now we have a total of 15.8 medication inside this bag. Okay, just gently mix it so that it's well incorporated. Okay, there you go. And now this is what I call like the 2.5 check, just to make sure that I have everything correct. So I have cefoxitin 1,500 milligrams for IV. The time is now and every 8 hours. And then this is for Miss Pamela De La Cruz. So I need to label the the one in the IV so that other healthcare providers know what's inside the bag. Okay, and then now I'm ready to insert. So I just need to wash my hands again. Grab my stuff. So the mini bag, the secondary tubing set, an alcohol swab, and then a label for the tubing. And then my mark. And now I'm ready. Okay. So now I'm on the patient. So this is what I do. So good day, Mrs. De La Cruz. My name is Ancy, and I'm gonna be your student nurse today. So I'm gonna be giving you a medication. It's called cefoxitin. Cefoxitin is for the treatment of your pneumonia. So usually this has some common side effects such as nausea, vomiting, and dizziness. And then usually it sometimes causes swelling of the legs and the feet. So if by any chance you experience some of these symptoms, just call us, and I'll also check you from time to time, okay? And then just want to make sure that your silent rays are up, and then your call bell is within reach. And then, okay, and then Mrs. De La Cruz, can I just check your armband? Okay. And for verification purposes, can you tell me your first and last name again, please? Thank you. And your date of birth? Okay, thank you. And then, now that I'm here, I'm also gonna be checking your IV site, okay? So the IV site is okay. There's no redness, there's no inflammation. And, okay, the IV, the primary line is infusing properly. And then, thank you for that, Mrs. De La Cruz. So now, I'm just gonna prepare your medications, okay? Okay. So now, I'm ready to do my third checks. Okay, just make sure for the patient, Mrs. Pamela, and then cefoxetine, 1,500 milligram IV. The time is now every 8 hours. And then also, I forgot to mention that at any moment of time, if the patient says no, did not agree on receiving the medication, he has the right to do so. Okay, so now I'm ready. So on my secondary set, I have this like do one. We just need to make sure that we hang the primary bag lower so that after our secondary bag is finished infusing, it would go automatically by gravity. And now we get the tubing. So for the tubing, we just need to make sure of the consistency, so there's no holes. All the caps are here, and then just make sure to clamp it before connecting, just to make sure the medication or any liquids won't splatter, okay? And now, what we do next is I choosing the port. So I choose the port before the Baxter pump just to make sure, or because we want the Baxter pump to also control the secondary infusion, okay? So you just need to clean this for 30 seconds, let it dry for 15, and then we are ready to connect. Okay. Okay. There you go. There you go, so it's connected. And then now we're ready to back prime. So to back prime, we just slowly release this the clamp. And then just make sure that we feel at least 1/3 to 2/4 of the chamber. Okay, there you go. Then we just clamp it again. Now we're ready to spike. So this end is clear and this end is sterile as well. So we just remove that one. Okay, and then we can now directly spike. There you go. There you go. Okay, and now we're ready to set. So as I mentioned to you a while ago, I want the medication to be set to be infused over 1 hour. So what would I do is the total of the one in the bag is 115.8, so I can round it off to 116. So I'll put 116 ml per hour, and then the volume is 116 as well. Okay, so 116 as well, and then I confirm secondary, and then I start. Okay, and then I need to once it's starting, I need to check if there is 2 to 3 or 1 to 3 drops here. Okay, so there you go. I see the first drop coming in. And then make sure that we also put a label on the tubing that has like the date and time of where we put it in, so that all other healthcare providers would know as well when to change the tubing. Okay, and then next thing to do is to document. So important thing is that we sign and date we put the time and our signature of when we give the medication. And then also, Mrs. De La Cruz, so I'm just gonna stay here for a while just to monitor you for any adverse reactions, okay? And then also, I'll visit you from time to time after that one, and then I would be back probably approximately after an hour after the medication has been fully infused, just to make sure that it has been fully infused and that there's no, you don't have any allergic reactions to it or any adverse reaction. And also as well to further evaluate you for the effectiveness of the drug. Okay? And then yeah, that's how you do reconstitute, dilute, and give an IV medication through a mini bag.